This video will cover bispectral index, or BIS, brain function monitoring for use in anesthesiology. BIS technology is used to monitor brainwave activity in patients under sedation. The goal of a clinician is to provide his or her patients with balanced anesthesia. This is achieved by proper management of three factors: hypnosis, analgesia, and immobility. But without a means to objectively measure the level of sedation, patients may be oversedated or undersedated. Immobility, or areflexia, is the absence of involuntary movement, while analgesia is a diminished response to unpleasant stimuli. There are well-established methods to monitor these conditions when a patient is anesthetized. However, measuring the third component, hypnosis, or lack of consciousness, has, until recently, posed a challenge. BIS technology meets this challenge by monitoring the depth of anesthesia or sedation and directly measuring the effects of anesthetics and sedatives on the brain. The BIS system includes the BIS Complete Monitor, patient and monitor interface cables, the BIS-X LOC2 or LOC4 module, which processes the EEG signal, a detachable power cord, and BIS sensors to monitor a range of patient populations. The BIS monitor displays the BIS index number, signal quality indicators for EEG and EMG, raw EEG waveforms, and trend data. The BIS monitor does not measure movement. Rather, it lets you know how awake or sedated your patient is by displaying a single index number between 0 and 99. 100 means completely awake, while 0 represents isoelectric or no EEG activity. The ideal range for patient comfort for most procedures is between 40 and 60. The BIS index is derived from the EEG using signal processing technology. BIS brain function monitoring helps prevent the negative consequences of overdosing and underdosing and leads to greater patient satisfaction with anesthesia. The technology helps you administer the amount of sedative required to meet the differing needs of individual patients. Thousands of peer-reviewed published articles have shown that BIS-guided anesthetic titration can help improve anesthesia and sedation-related clinical outcomes. BIS technology is especially valuable when you are monitoring patients with individual anesthetic requirements that may be affected by a number of specific conditions, such as age, gender, substance abuse, hypoglycemia, hypothermia, and complex conditions, including cardiopulmonary bypass and trauma. In challenging situations, such as mechanical ventilation, neuromuscular blockade, drug-induced coma, and bedside procedures, the BIS monitoring technology can help the clinician to better assess the patient's sedation needs. And no two patients respond exactly the same way to a given drug dose. BIS monitoring provides a patient-specific measurement of consciousness, taking into account these variations. This targeted approach helps you customize anesthetic dosing to the physiology of each individual patient, helping improve clinical outcomes. Optimizing BIS brain monitoring performance depends on proper sensor placement. The BIS sensor should be positioned at an angle across the forehead, and each electrode must make firm contact with the skin.